My name is Kate Holliday and I'm a nurse. I'm also a researcher, chief executive and founder at CCDR. And CCDR is the Centre for Community-Driven Research. And within CCDR, I developed the Pathways Telehealth Nurse Service. In 2012, I started CCDR as a charity, and I started it for a few reasons. The first was that the conversations I would have as a nurse with patients just weren't resonating with the policy decisions that were being made, whether at the local, state, or federal level. And I'd also worked for government and large international organisations, and patient groups would approach you with an issue. And of course, your heart goes out to them. But on the decision-making side of the table, you need evidence to demonstrate who it affects and how it affects them. My career journey started as a new grad at Concord Hospital, and I ended up later working in America in drug and alcohol rehab. So that was my first community-based role, and it's where my interest was sparked in the value of providing care in the community and in a setting that's comfortable and familiar and accessible to patients. Within the program I run, I'm also the Pathways Telehealth Nurse for people with rare and genetic disease, and I provide that service for 3 organisations under the GUARD Collaborative, which is the peak rare disease body in Australia. We also host community groups in liver cancer, Ehlers-Danlos loss, and NMOSD. And these are patient populations that had no organisation to support them. So we stepped up to help those small communities. In the early days of the service, the Pathways model was tested in pancreas cancer. It was then funded by the Commonwealth to expand into 10 disease areas. And in March this year, the now Minister for Health, Mark Butler, joined our NPON Australia conference and made an election commitment that the program would be funded and expanded into 18 disease areas. What we've been able to do with the nurses in the program is to identify the kind of nurse-led interventions that are possible and safe for nurses to do in the setting of a health charity. And now we have guidelines for these that haven't existed before, which gives them a scope of work. We've also been able to calculate the average time spent with patients across disease areas, and that means for the first time we have a solid basis for costing human resources. We've also identified a minimum data set that we can use going forward for service evaluation. But the most important part of the model is getting patients back into the health system and taking up the services that they need. Delivering better models of care for me is often about looking at the resources in front of us, and as a starting point, asking that question, how can these be arranged better to suit the needs of patients? If there is a problem, we shouldn't just be fixing that for one person or for one subgroup of the population. We need to take that problem and ask, what is the health system change that's needed so that that problem doesn't happen anymore and so that the most people can benefit? And when we are seeking solutions to challenges in the health system, nurses need to get involved. We need to speak up. The most important achievements come from working with others. So this is really a recognition of the team at CCDR, all of the Pathways telehealth nurses, and all of the patient organisations we work with in NPON Australia that are such an important part of the health system. Being a finalist is truly an honour, and I'm going to enjoy the moment today, but then tomorrow it's back to work.